I'm going to say a few words about pacemakers. So when is a pacemaker necessary? As you know, pacemaker is necessary when there is a heart block and the patient becomes symptomatic. By symptoms, it may be dizziness, it could be blackouts, at times it could be shortness of breath on exertion, and if a patient with these symptoms are found to have heart block, then a pacemaker may become necessary. So what is a heart block? Now this heart block, as we doctors mean, is not the heart, which is actually a mechanical block. By heart block, what we mean is a blockage in the electrical circuit of the heart. As you know, in every heart there is an electrical circuit which causes the heart to beat. If there is a problem in this electrical circuit, then it may cause the heart rate to slow down, and at times it may even stop for a while, which may cause the patient to feel dizzy, or if severe, may cause the patient to black out. So this is heart block, and then a pacemaker is necessary. As you know, pacemaker is a metallic device which is inserted under the skin below your collarbone, and it has some wires which run through the vein into the inside of your heart, and this wires connect the metallic device with the inside of the heart. What the pacemaker does is it supports the heart, it gives electrical current to the heart. So if there is a problem with the electrical conduction and if the heart rate goes down, then the pacemaker would make the heart run appropriately. Now, you must have heard about single chamber pacemaker, dual chamber pacemakers, temporary pacemakers, permanent pacemaker. What are these and when are they indicated? Now, permanent pacemaker is the pacemaker that we normally use and put it, as I've just described, it is placed under the collarbone, below the collarbone, underneath your skin. Why I say traditionally, because now you also have a different type of pacemaker, a permanent pacemaker, which could be inserted through the vein of your leg up inside the heart without actually putting an incision on your chest. And this is done in a similar way as we do an angioplasty and put in a stent. Similarly, this is done under local anesthesia, where we go through the vein of your leg and actually put the pacemaker, the small device, something like a coin, inside the heart, and which takes over the function. However, this is more expensive, and at this moment my discussion would mainly center around the more traditional pacemaker that we put under the skin by making an incision. So these are the two varieties of permanent pacemaker, but sometimes a temporary support to the heart is necessary in case of heart block, which may be to buy time so as to make arrangements for a permanent pacemaker, or could be to tide off a difficult situation which may arise during surgery or any other illness where temporary heart support is necessary. So these are the temporary pacemakers, and such temporary pacemakers are external pacemakers where a wire is in, but they are kept only for a very short period of time, maybe for a few days at the maximum. Now, what are single and dual chamber pacemakers? Now, as you know, the heart has four chambers, two upper and two lower, and so that's why physiologically, when a heartbeat, contribution of both the chambers are necessary to give optimum performance of the heart. However, it does not matter which sort of pacemaker you put in, single or dual. All pacemakers would prevent the person from blacking out. That since in a dual chamber pacemaker both the upper and lower chambers are stimulated, that behaves very much like the physiologically like your heart, and so it doesn't cause any other symptoms. Whereas in a single chamber pacemaker, since only the lower chamber of the heart is stimulated, so although it prevents someone from blacking out, the contribution of the upper chamber of the heart is missed. So this may cause shortness of breath when you are walking or exerting yourself. So if you want to prevent a breathing problem on exertion, then it may be better to put in a dual chamber pacemaker. However, having said that, I must also say that some are very old, maybe infirm, and he doesn't take much of exercise, almost bedbound. In such cases, putting in a single chamber pacemaker is perhaps not going to make much difference. So this is about single and dual chamber pacemaker. And then you may have heard about pacemakers which are MRI compatible and some are non-MRI compatible. So what are these? Again, traditionally all pacemakers were non-MRI. In other words, you are not able to do an MRI scan if necessary in future once a pacemaker is implanted. But nowadays we have pacemakers which are MRI compatible. In other words, if it's necessary ever in future to do a MRI scan, then you would still be able to do it if you have this pacemaker. There's no problem in doing a CT scan. Also, a pacemaker could be rate responsive or not responsive. Not rate responsive. What does that mean? Now, nowadays mostly all the pacemakers are rate responsive, and by that means that the devices have a inbuilt mechanism which would sense whether you are active or not and may increase your heart rate automatically. I'll give you an example. Say if you have a pacemaker which is fixed at 70 or 80 per minute, say, and you are actually maybe fine if your heart rate is 70 or 60 per minute and you are relaxing, you are sleeping, it's not cause much problem. But if you are doing a vigorous activity, normally your heart rate would go up. But if you have a fixed pacemaker which is not responsive, then the heart rate would remain 60 or 70 even when you are exerting yourself, and in such cases you may start becoming short of breath. But rate responsive pacemakers have sensors inbuilt which would detect that you are exercising and would automatically increase the pacemaker rate so that you do not get short of breath. Nowadays most of these pacemakers are rate responsive, so hardly there is any pacemakers which are not.